is Lillian Little, and I would like to take time in this brief segment to give my opinion about the laws on pregnancy and drug use. When you think of pregnancy, most of us think as long as it's healthy, it doesn't really matter if it's a boy or girl. These words will be honored after the segment. One human's life is worth more than anything to some people, and to others, it's not as important. As I go on with this topic, I will list several examples and harmful effects of the drugs being conveyed to the unborn child from drug use by the mother, and some of the laws that's stated first off in the Virginia Code 18.2-32.2 states that any person who unlawfully, willfully, deliberately, maliciously, and with premeditation kills a fetus is guilty of a Class 2 felony. In my opinion, a Class 2 felony is not enough. Punishment to the mother is not enough because the mother is willfully using the drugs and is causing harm to the fetus. Killing a human is wrong no matter what age the human is, either born or not born. A life is a life. Being willfully, deliberately, and premeditated on killing a fetus is unorthodox. Virginia laws need to be updated due to the fact that killing is killing and murder is murder. So therefore, expectant mothers should be prosecuted farther than a felony. As for on trial as murder, if another person kills the fetus, the charge is murder if the fetus dies. Why is this law not upheld for the mother that is using the drugs that's causing the harm or even killing the fetus? Some effects of the drugs that take part to the unborn fetus I will give you examples of. Heroin, cocaine, alcohol, marijuana, and methamphetamines are only a few of the drugs that are used. First, according to priests who wrote Alcohols, Drugs, Medication, and Pregnancy, heroin is an opioid, a painkiller, and it is highly addictive. When one does heroin while pregnant, the results of the unborn fetus is slow growth developments, resulting in premature birth, as well as heart failure, intestinal damage, and also blindness. Another one is cocaine, also known as crack. It is a strong stimulant, almost the same effects as heroin. Fetal alcohol syndrome is a congenital syndrome caused by excessive consumption of alcohol while pregnant. According to Sahin, Nivan, Horton, Gunger, and Iliake, who wrote Birth Defects, the consumption of alcohol can cause cleft lip, which is the upper part of the lip is thinner than normal, or it can cause cleft palate, which is a congenital split in the roof of the mouth. This is due to failure of the palatal shells that come fully together on either side of the mouth. This occurs during the first month of development in the embryo. Next, marijuana is almost like cigarettes. This is a herb that can cause harmful problems to the fetus. Stated in Introductory to Maternity Nursing and Pediatric Nursing on the 6th edition, wrote by Gloria Leffer. Marijuana also is known as weed. It can increase the carbon dioxide in the blood. Withdrawals also can occur. And some of the signs of withdrawals are tremors or shakes or long periods of crying after birth. This can also lead to diarrhea, cold sweats, nausea, vomiting, and seizures. And in some cases, it can even lead to death. Gloria Leffer also states methamphetamine causes low birth weight, bleeding from the brain, and also it can cause a miscarriage. Babies can also be born without proper functional organs or body parts. Due to the lack of the nutrition the mother should be providing for the child. The VA Code 18.2-32.2 in 2004 stated that any human that is unlawfully kills a fetus is only charged with a Class 2 felony. Any person who unlawfully, willfully, deliberately, and maliciously kills the fetus is cruelty or felony, punishable by confinement in a state correctional facility. But they are less than 5 months, but no more than 40 years, according to Martha Schroeder, who wrote Illegal Drugs in Pregnancy and Targeted by Proposal Laws. 13 states and the District of Columbia included prenatal exposure of infants and fetuses, drugs, and the deterioration of child abuse and neglect. According to the Federal Children's Bureau, also Schroeder states fetal assault and fetal homicide laws specifically exempt actions and conduct by pregnant women. This means that they should not be held accountable for the death or even charged with murder, is what this is really saying. Senators in 2006 voted down a proposal to apply the fetal assault law to pregnant women using drugs, guilty of a felony, as the conclusion is coming to a near. No matter how women is using or used, the effects and the outcomes of the child is what's important. Laws need to be stricter and then stricter than they should have been before. Just a felony is not good enough. It needs to be punishable and then imprisonment. Personal opinions are in fact a great persuasion, but in the end, it is doing harm to the fetus, the drugs, during or even before the child is born. The laws need to be stricter and the mother held accountable for the actions. Thank you for taking your time to listen to my speech, but I am a jail nurse and I have seen firsthand what the effects of the drugs do to the mothers. I have seen needle marks all up and down their arms where they have injected the drugs for the use. And I have seen the lack of compassion or the welfare of the child that the mother has for it. Because as soon as they are out of jail, they will go back to the drug use and will return within a month doing the same thing. So again, I thank you for listening to my speech, and I would like to show you who my audience is now. And this is my audience that has listened to my speech for the last 3 times. Thank you. Have a good day.